Hello friends, let us now learn some important points about breast cancer in pregnancy. If you see the breast cancer in pregnancy, the incidence of breast cancer in pregnancy is 1 in 3000 pregnancies. The most common this breast cancer is the most common type of non-gynecological malignancy in pregnancy is breast cancer. Then in the breast cancer, the most common type of breast cancer involved in pregnancy is invasive ductal cancer, and in the pregnancy the most common symptom seen in pregnancy is presence of breast lump. If you see, breast changes are common in pregnancy, and the breast changes which normally occur in pregnancy might mask the breast changes due to carcinoma, and as a result the patient can present in advanced stage of disease they can present, and because of that almost 75% of patients will have axillary lymph node metastasis at the time of presentation. If you were asked about the investigations, first investigation which is done is ultrasonography. Then investigation of choice for diagnosis is biopsy, and mammography is not a preferred investigation. If you see, mammography is not preferred investigation. Then the treatment we will see. Treatment in pregnancy is very important. If it is an early invasive breast cancer, then we should do simple mastectomy should be done for the treatment. And if it is a locally advanced breast cancer, then we should give neoadjuvant chemotherapy with modified radical mastectomy with radiotherapy should be given if it is locally advanced breast cancer. But now the question is, when do you give these neoadjuvant chemotherapy, modified radical mastectomy or radiotherapy? So if you see, if anyone gives general anesthesia in first trimester to a pregnant woman, then this general anesthesia will relax the uterus and it will increase the risk of abortions, and as a result we avoid general anesthesia in the first trimester. So the modified radical mastectomy cannot be done in first trimester, so it is done in second trimester, right? This is about modified radical mastectomy. Now about the chemotherapy. See, maximum organogenesis mainly occurs in the first trimester. Because organogenesis occurs in the first trimester, chemotherapy is contraindicated in the first trimester. So as a result, the chemotherapy, neoadjuvant chemotherapy, can also be given in the second trimester. Then if you see the radiotherapy is actually completely contraindicated in pregnancy. So you will give radiotherapy after delivery. So neoadjuvant chemotherapy is given after the completion of first trimester, that is in second trimester, and modified radical mastectomy is also done in the second trimester, and radiotherapy is given after delivery. So that is the treatment for locally advanced breast cancer. If it is early invasive breast cancer, simple mastectomy can be done. Thank you for watching.